Hello, my name is Kim, and in this video, I will show you how our storage procedures are being done at CSSD in North Shore Hospital. A reusable medical device before being stored in the storage room must be sterilized and cooled down completely. When the load is finished, we must follow the procedures for the autoclave machines to handle the load properly. When we unload the instrument from the autoclave machines, we must secure the trolley before unloading the cart. The cart will be very hot. We must wear the mittens to protect our hands when we pull the cart out. After you finished unloading the cart, quickly check inside the chamber for any items that might have dropped. Then we can proceed to close the door and push the trolley to the designated area for cooling down the equipment. According to Standard 4815, storage areas for sterile items shall be controlled to prevent contamination and shall be dedicated for that purpose only. The storage environment shall be free of dust, insect, and vermin. And because the trolley is very hot, a warning sign is very helpful. After we unload the equipment from the autoclave machine, we need to do a quality check on the instruments if there are any tear on the packaging, any broken seals, or any condensation presenting. If all instruments are good to go, we can let them cool down completely before placing them on the trolley. This is an example of how to identify if the instruments are sterilized. Any instruments that are wrapped with KimGuard, we use the indicating tape. After sterilization, the tape will change color from light green to black. Any instruments that are packed inside a SteriPeel, to know if it is sterilized or not, we can check the pink indicator on the packaging. If the instrument is sterilized, the indicator will change its color to brown. Each batch of sterilized instruments has its own list. We keep this document to make sure that the instruments leaving the department to go to the storage areas are sterilized and safe to use. In case any instruments are non-conforming and has to be returned to reprocess, we can scan the item's label and keep the label together with the document so that we know the item of this batch is not safe to use and has to be reprocessed. According to Standard 4815, a package shall be considered non-conforming, meaning non-sterile and not suitable for use when it is incorrectly wrapped, it is damaged or opened, it is wet after sterilizing cycle or comes into contact with wet surface, it is placed or dropped on a dirty surface, it has no indication of having been through a sterilizing process. In case any instrument is too heavy to carry, a transporting tray is very helpful to support the weight of the instrument. It also helps the staff to carry the instrument safely without damaging the packaging of the instrument. When the instruments are completely cooled down and safe to be transferred to the storage area, we can proceed to transfer the trolley of sterilized instruments into the clean lift to go upstairs. In North Shore Hospital, CSSD staff will only put the trolley in the clean lift to go upstairs. Then the nurses or healthcare assistants will proceed to place the instruments onto their designated shelves. We only keep some instruments in CSSD for other wards when they need, such as pool universal instruments for birthing department. All staffs in CSSD and nurses, healthcare assistants who are involving in stacking the instruments are well informed about the stock rotation to make sure the instruments which got sterilized first will be used first. According to Standard 4815, each office-based healthcare facility shall develop a system of stock rotation based on the date of sterilization or load number. And that concludes my presentation for this video. Thank you for watching.